Welcome to our New Hampshire HealthCost webinar. HealthCost is a free medical price transparency tool developed by the New Hampshire Insurance Department. The mission of the New Hampshire Insurance Department is to promote and protect the public good by ensuring the existence of a safe and competitive insurance marketplace through the development and enforcement of state and federal insurance laws. There is a need for price transparency. New Hampshire residents shop and compare the costs of TVs, hotel rooms, and cars. Consumers have a right to do this with their health care too. In the healthcare system, patients rarely know the cost of services before they receive them. Patients' cost sharing has increased dramatically in recent years. High deductible plans are very common and patients face greater exposure to the cost of care. The HealthCost website is a resource that you can share with your patients. It is free for anyone to use and you do not need to have an account. The site is also mobile friendly. Patients can pull up the website on their phone or tablet while they are in your office. Many patients may feel uncomfortable starting a conversation with their providers about price, even if it's something they want to discuss. This can be a good way to start the conversation for everyone. There are three main areas within the site: costs, quality, and a guide to health insurance. Starting with costs, patients can compare the cost estimates for medical, dental, and prescription drugs. The cost information is derived from the New Hampshire Comprehensive Healthcare Information System. This is our state's all-payer claims database. We use the median cost from this insurance claims data for medical facilities and providers in New Hampshire. The data is updated quarterly. To view medical cost estimate data, the patient should select their type of insurance coverage. HealthCost currently includes the top 3 largest insurers in the state, an other insurance category, and an I do not have health insurance category. Patients who have insurance can also enter their deductible and co-insurance information, which they can find on their health plan card. You can then search by keyword, or you can simply browse and select from the categories the type of medical procedure that you want to view. If you see this type of icon next to the procedure name, this means that it is a bundled procedure. Bundled data includes the cost estimates of all of the associated costs of a typical patient experience on the day that they have their procedure. This includes facility fees, provider fees, anesthesia costs, etc. These are the cost estimates for a knee x-ray. The HealthCost website also includes CPT procedure codes. The results will be shown alphabetically to start. You can also filter by distance from a particular zip code and then hit submit. This depends on how long a patient is able or willing to travel. Results can also be sorted by the estimate of total costs, what their insurance would pay, and what they might be expected to pay. If a website user were to select I do not have health insurance before looking at procedures, the cost estimates presented would also include the facility's uninsured discount. The advanced view also includes a precision of the cost estimate, or how much we think the actual patient cost will vary from the cost estimate provided on the website. We also include typical patient complexity data, or how sick the patient was at the time of care. Since 2016, New Hampshire HealthCost also includes dental cost estimates. The website displays this information similarly to the healthcare data. Patients can select a dental carrier or I do not have dental insurance. Patients can choose to either enter their dental plan, deductible, and co-insurance, or to leave this blank. Again, you can also search by dental procedure name keyword, or you can simply browse and select a specific procedure. Dental cost estimates can also be filtered by zip code and distance. and by the total estimate of cost, what their insurance would pay and what they would pay. New Hampshire HealthCost also includes retail prescription drug costs for 35 brand name and 30 generic drugs. You can find drugs by searching or browsing. Cost information is presented by pharmacy name, the dosage, or the amount, frequency, and method of consumption, and the estimate of total cost. Generic drugs also include brand name cost comparison for pharmacies that carry those prescriptions. If the patient has health insurance coverage and the drug is included in their plan's drug formulary, their actual out-of-pocket expense for the drug will likely be less than what is shown. New Hampshire HealthCost also includes quality data for 26 New Hampshire hospitals. These data are derived from nationally available sources, the Centers for Medicaid and Medicare Services and the Joint Commission, and are presented in an easy-to-read format. Quality measure data includes things like readmissions, infection prevention, and time and effectiveness, and more. Data are presented by hospital and based on the national average rating for all the hospitals that report this measure. You can also filter the results by zip code, and the source of the data is shown at the bottom of the screen. The third component of the website is a guide to health insurance for consumers. This is a great resource for patients that are new to insurance or could benefit from learning more. The information is presented in a question and answer format. The most commonly viewed questions are featured here at the top of the page. You can also search based on keywords. The topics of the questions include getting health insurance, navigating the system, and managing your health costs. Questions under navigating the system include information on referrals, in-network versus out-of-network, emergency care, and more. Answers to questions may include diagrams such as this, videos, helpful links, or bullet points to explain the concept. Insurance terminology that may be difficult to understand is underlined as a glossary term. And you can wave your cursor over the underlined term, like this, to see the definition without leaving the page. You can also provide feedback on whether the question was helpful or not helpful, and you can view other related questions to learn more. If you would like to learn more about the methodology that was used to find the data used on this site, you can click on About and then visit Methodology for Health Costs for Consumers. This is it for our tour of the New Hampshire HealthCost website. We hope that you have found this useful and that you will share this with your patients. Again, the data is updated quarterly, and we plan to make improvements to the website. So please come back and visit www.nhhealthcost.org in the near future. Anyone using this website can contact the New Hampshire Insurance Department with questions, comments, or feedback through the Contact Us tab on the About page or using the information presented on the screen. Thank you.